So we've dropped the tone in the hypertonic regions in Leona's multifidi, but there still remains a place. I can find it again. A place where she doesn't have a lot of fullness here. So once we drop the tone in all this injured and scarred up stuff, we need to make sure that things get nice and strong in here. So the way we do that is we ask the person to puff up this area right next to the spine here. And it's not the easiest thing to do for a lot of folks, especially if they've had back pain. So it's also facilitated by contraction of the transversus abdominis and the pelvic floor. So I usually have people for a week or two just working on their transversus abdominis and their pelvic floor. So the way they do it in this position, after they've been trained on how to do this, is Leona takes a nice full breath in, and as she exhales, she draws her belly button up towards her spine, and you can see the waist is narrowing, and then just relax. So that's the result of the transversus drawing her waist together. The next cycle, when she exhales, she's going to draw that together and draw her pelvic floor upwards, and I'm going to ask her to swell her muscle here right next to the spine. So if you can take another breath in, and so belly button in, pelvic floor up, and you swell. That's awesome. So I just find a place, and then breathe again. I just find a place, any place where there's recruitment in the multifidi. And then I ask them to feel that. And then I ask them, especially as they're exhaling, to recruit that muscle all the way along. So take another breath, please. As you exhale, do that triple contraction. Nice recruitment here. Nice, 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 nice. Not so nice. That's great. And then what we do is we facilitate recruitment where Leona can do it. So another exhalation, please. Yeah. So that right there, you want it to happen all the way down in here. So let's exaggerate this again. That right in there. Nice. Make it all the way down, make it all the way down, all the way down. Oh, and it's almost all the way down. That's great. So she just works for a few cycles of breathing while I stimulate with a transverse mobilization or a bit of tapping. But I really want to connect to those fibers. She's recruiting in there. I want it to happen in there. Right on the edges. She's got a bit there and it's weak there. So I just keep strumming and stimulating the place where she's got some inhibition, but just before it's lost. And then we gradually work our way into there. Eventually, people learn how to recruit into that location, and it becomes a little bit stronger. Now, as people learn how to recruit in here, then you introduce additional loads so that they recruit in here and make it a little bit stronger, and then they'll extend this leg at the hip, bringing it up while they recruit in here, and then they work on the other one. You can have people lifting, one arm up above them, then the other, or lifting their head or their hands behind their heads. Eventually they can do this on gym balls and so on. And it's a great way to address a very precise weakness in a muscle. And it's sweet that it's identified through this palpation, and then people's awareness is brought to the muscle through strumming and pansement.